Hello, welcome back to my channel. Thank you so much for joining me. This is part 2 of the diabetes disease interaction codes video that I was going to do for you. So today's video, we're going to talk about DKA. Sometimes, physicians like to abbreviate things and not like to write the whole name out. So we're going to talk about DKA. And as you know, this series is about diabetes. So now we're talking about diabetes with ketoacidosis, which is DKA. So DKA is a serious diabetic complication where the body produces excess blood acids or ketones. This condition occurs when there isn't enough insulin in the body. It can be triggered by infection or other illness. So the symptoms can be thirst, frequent urination, nausea, abdominal pain, weakness, fruity-scented breath. Treatments may also include like hospitalization to kind of like replace your electrolytes, or may do insulin therapy. And also therapy. DKA can often be the first sign. You can read this, you pull it up online when you look at DKA, signs and symptoms, treatments, and just the condition itself. And you'll see where it says DKA is often the first sign of someone with underdiagnosed type 1, which is insulin dependent. So again, welcome back to diabetes and disease interaction codes. As aforementioned, we're talking about diabetes type 2. Also, remember that you're going to rarely ever use E11.9, which is diabetes without complications. I can almost always guarantee you that if someone has diabetes, then more than likely they have a complication or 2 or 3. Also, do not use an E code that reflects a complication and use E11.9 at the same time. For example, let's say you're reading a chart or whatever, and then you so happen to think you're ready to code it. And when you code it, this patient, let's say they have PVD, which is peripheral vascular disease, and they also have diabetes. So there is a disease interaction code, and we'll talk about that in another video, probably like part 4 or 5. But that code will be E11.51, which is pretty much diabetes type 2 with PVD. So if you're reading a chart and it says that, you're not going to use E11.9, which is diabetes without complications, and then also use E11.51. You're not going to use that because the E11.51 code shows a complication. So how can you use an E code for type 2 diabetes that shows a complication and also use the E code for diabetes without complications? That's a direct conflict. So never use E11.9 with the E code that reflects diabetes type 2 with complications. And like I said, you're going to rarely ever use the E11.9 code because diabetes diabetic patients just almost always have complications. So also remember to check the medication list inside of the patient's encounter, because if they are on insulin, you're going to use the code Z79.4, Z as in zebra, 79.4. If they're on oral hypoglycemic medications or oral anti-diabetic medications, you're going to use Z79.84. So again, today's video is type 2 with ketoacidosis, and that specific diagnosis has 2 different codes that you will use, and we'll get into that later on in the video as far as those specific codes. So when they're diagnosing you with DKA, you're usually going to get a blood test or blood work, or they'll do a chest x-ray to see if you have pneumonia, things like that. So I'm sure all of you have heard of the keto diet. Heard of the keto diet? Okay. So this plays a factor in the keto diet. So the keto diet is a special high-fat, low-carb diet that's usually referred or recommended for type 2 diabetics to do, or whatever, the high fat, low carbs diet, because it can change the way your body stores and uses energy, and it also can ease the diabetes symptoms and things like that. Now, although this diet is known to improve blood glucose levels, there are associated risks with this diet, especially if you're already under the care of a physician. So if you have type 2 diabetes, or if you want to start the keto diet, it's always good, always good to consult your physician first. So let's talk about what we came to talk about today. So there's going to be DKA, diabetes type 2, with ketoacidosis. So that code, if you look inside your book, and I have my book here, so I'll tell you the specific page. So let me go to the E11 category, and I'll be able to tell you the specific page so you won't be thumbing through your book. So inside the 2021 ICD-10 CM book, CM book, is going to be page 533. And when you go to page 533 and you look up E11.1, which is type 2 diabetes with ketoacidosis, you're going to see beside that code, you're going to need a 5th digit when you see E11.1. So that lets you know that E11.1 by itself is not enough to be a valid code or to be a billable code. You're going to need a 5th digit. So there are 2 codes associated with diabetes with ketoacidosis. The first code is going to be E11.10, and that's going to be diabetes type 2 with ketoacidosis without coma. The second code is going to be E11.11, which is type 2 diabetes with ketoacidosis with coma. So when you're reading the patient's chart, you have to be very careful in what you're reading so you can be sure to capture the appropriate code for what's going on with the patient. For example, if you're reading the chart and it says the clinician is rounding at the hospital, observing and evaluating a patient that's in a coma with DKA and high blood pressure. If you see that the patient is in a coma and the patient has DKA, then you're going to use E11.11 because that's the code for diabetes type 2 with ketoacidosis with coma. So if you're reading the patient's chart and it goes a little something like this: patient presents to the emergency room with diabetes. The patient is complaining of pain and weakness. Upon drawing blood, we receive the results of the blood work. Patient has high levels of acid. I'm diagnosing the patient with DKA. So what code will we use? We will use E11.10, which is diabetes type 2 with ketoacidosis without coma. How do we know the patient is not in a coma? We know because it says the patient presents to the ER, which is coming to the ER and complaining of pain and weakness. If you're in a coma, you would not be able to complain of pain and weakness. Also says it's diagnosing the patient with DKA. So we know the patient has DKA. We know the patient is not in a coma. So it's going to be E11.10, diabetes type 2 with ketoacidosis without coma. So again, please join me for the diabetes disease interaction codes. We're going to go through the entire list for diabetes type 2 and the disease interactions. Also remember as well, if you're reading the patient's chart and it says that the patient has diabetes, but the diabetes is not specified whether it's type 1 or type 2, you always assume that it's type 2. That's per your coding guidelines. If you're reading the reading the patient's chart and it's not specified, automatically assume that it's diabetes type 2, which is the most common type of the diabetes. So thank you so much for joining me for part 2, which we talked about diabetes type 2 with ketoacidosis with and without coma. If you have any questions, please drop them down below in the comment section. Also follow me on my other social media platforms. Instagram is going to be the Coding Coach _CPC. Facebook is going to be Dynamic Medical Billing and Coding Group. And of course, if you're here, you're already following me on social media. My website again is almost launching soon. Just notate that website, which is www.alliedhealthprepacademy.com. Don't forget to like, comment, and subscribe. Thank you so much for joining me. Share this video among your other coder friends, people who are interested in coding, or someone who just likes to know more information about medical things. Thank you so much for joining me again, and I will see you for part 3, where we're going to talk about diabetes type 2 with kidney issues, kidney complications, nephropathy, chronic kidney disease, all of those things. So thank you so much for joining me, and I'll see you next time.